my name is Kelly Archer and I'm a clinical psychologist who works at St. Michael's, which is a part of UH Bristol. I've been asked to speak to you by Liz Marks to give you a little bit more information about the placement we have up at St. Mike's, but also to give you more of a feel of working in clinical health and, talk to you about kind of what particularly attracted me to clinical health. So, but up at St. Michael's, the team that I work in is called Women's Psychological Health Services, and it's myself and the head of the service, the lead of the Women's Psychological Health, Sam Cole. And I was just going to kind of talk through, what specialities that we provide input into, and a little bit about the nature of that work, not only the direct clinical work, but the more the stomach indirect work and networking with the colleagues within the hospital, what that might involve. And then talking more broadly about what's interesting about health. So up at St. Mike's, there's three kind of specialities that we kind of provide input into. One of them is maternity. So that's anyone who is currently pregnant or who had a traumatic birth, and we will see people up to 1 year after a traumatic birth experience. To just make a differential, it's not like a perinatal mental health team. It's not a mental health service. It's very much our involvement is around the hospital experience. So whether it's particular anxieties about being pregnant, about the birth, so there's particular phobia, tocophobia, are they anxious about the birth? Is there anything we can do to support them in preparing for that? Or providing kind of enhanced birth planning, providing psychological formulation and networking with staff to ensure that to reduce distress as much as possible for the patient and then their hospital experience. So for example, if they've had like a previous pregnancy loss, they were told at a scan that their baby died, it might be that scanning department is particularly triggering, and so just making staff aware of that or helping the patient to prepare, kind of grounding, so when they have to go through kind of any hospital procedure. So it's really basically supporting patients through their hospital experience and making that as compassionate as possible. So you get the kind of antenatal work, which is during pregnancy. We also do support neonatal loss, so kind of late pregnancy loss after 20 weeks, so that can be for various reasons, or kind of some particularly complicated emotions around terminations for medical reasons, and kind of mixed emotions of that. And our role is not necessarily bereavement counseling, but just to ensure that patients are engaging in the resources and there's nothing pathological developing and their kind of grief reaction, so assessment and some preventative work and signposting is appropriate. And also a part of maternity, we do work with traumatic birth experience, and that's quite interesting if you have an interest in trauma, and it can really vary from kind of developing a narrative and liaising with the obstetric team to kind of fill in the gaps, and just ensuring that patients are engaging in behaviors that are going to reduce likely PTSD symptomology in future. So it's again more of a preventative work, and as it's, we only see patients up to a year after the birth. It's less kind of a longer people with historic kind of PTSD. And then the other part of women's psychological health is the gynae oncology. So oncology is held kind of down the hill, adult oncology, but we do the gynae oncology because it's at St. Michael's, and that's kind of where the gynae department is. So that's very similar to cancer work, lots of reoccurrence fears, kind of adjustment to new identity after cancer, survivor guilt. So really, really interesting, thinking about mortality. I think a lot of themes in that work, is about that tolerating uncertainty and recurrence fears. And the indirect work as well is if, there is across the board, if there's any kind of procedural anxiety or about needles or any of the interventions they have, supporting patients so they can kind of engage in their medical work as they, in their medical treatment as appropriately. So that could be providing kind of practical tips, or also liaising with the medical staff to provide more psychological formulation for that. And then the NICU is a neonatal intensive care unit at UH Bristol. And our work is, supporting families who are going through a really stressful situation, having a little one. Again, providing coping strategies, normalizing, making sure they're kind of engaging with as much, they're engaging with the support resources as much as possible, making sure they're engaging in behaviors that are going to be protective rather than kind of lead to pathological responses and disengagement, and also liaising with the team to provide kind of maybe management plans if a family are particularly vulnerable, manage communication, how to kind of communicate with this family who are highly distressed, etc. So and all this work, I'd say that the direct clinical work is really important, but if you like networking, if you're really interested in systems and teams working and providing psychological formulations in a medical model, this is a really great opportunity, a really good placement to do that, which is something I'm really passionate about. And I think that psychology should be embedded in all our care. We shouldn't have kind of parachute psychologists who just come in when needed. We need to kind of all be thinking more holistically about kind of patient care. So that's what's really attracted me to this role and to health. I think working in health psychology is really empowering. You can really help patients who are struggling in extraordinary circumstances, and ensuring they're kind of engaging with whatever they need to do as best they can. So I think it's really validating. I think in terms of the skills you use, I think it's a job where you kind of use all those clinical skills that you've been taught about in training. Not only about being a clinician and that direct clinical work, but the indirect work, the networking, the kind of using the evidence base as a guide and communicating that to teams as what's going to be most helpful. Supervision is so crucial, and not only with your psychology colleagues, but supporting and supervising medical colleagues who are working under high pressure environments and extraordinary circumstances, with themes of bereavement and reoccurrence, and these are difficult areas, and so there's lots of opportunities for supervision, which is really interesting, and providing consultation, advice, training. We do lots of training and teaching on psychological models, communication. So the thing that really ticks my boxes is the variability. Is coming into work and knowing that every day is going to be completely varied, and working particularly in an acute hospital, we do have outpatient work, which is a lot of work, but there's also that acute work, not knowing exactly what's going to happen, what the day might bring. And if that's something that interests you, or if you like someone who likes to know exactly what's happening day by day, it might feel a bit unnerving, but it is also, if you're like someone who likes variety, who likes to kind of be involved, be networking, working in an environment where you can make a huge impact in acute stress, I think this would be a great placement, and I think clinical health is brilliant, but I am biased. And any questions, I think my colleague Sam Cole will be available, so do ask her if there's anything that I've missed. But good luck with choosing your placements and the rest of your training.